Hello, welcome to Scratching the Surface. My name's Kamron. I'm a social work student at the University of Toronto, and I'm doing my practicum placement this summer at Recalibrate Therapeutic Services. In this video, I'll be covering schizophrenia and psychosis, which is probably the most stigmatized mental illness in the world. When the average person thinks about schizophrenia, the words that likely come to mind are like crazy, insane, and possibly dangerous. When we see violent incidents take place on our transit systems or in public places, the mental illness that usually comes to mind for a lot of people is schizophrenia, and it makes sense given how schizophrenia is portrayed in the mainstream media. So in this video, I'm going to define schizophrenia and psychosis, talk about its possible causes, address the stigma surrounding it, cover some of the myths and facts around it, and finally touch on some psychotherapeutic treatment approaches for schizophrenia. So without further ado, let's jump into it. So here's my presentation on schizophrenia and psychosis, and we can begin with a definition. So schizophrenia is a chronic brain disorder that affects how a person feels, behaves, and relates to others. For someone living with schizophrenia, their perception of reality is fundamentally altered, which makes navigating daily life incredibly challenging. Now, the symptoms of schizophrenia are often grouped into three main categories. There's the positive, negative, and cognitive symptoms. Positive symptoms are those that are added to a person's experience, such as hallucinations or delusions. Negative symptoms refer to things that are taken away from a person's experience, like a loss of motivation, social withdrawal, or the inability to express oneself emotionally. And cognitive symptoms affect a person's memory, focus, or their ability to follow a conversation or to make decisions. This brings us to the broader concept of psychosis. While schizophrenia is a specific disorder, psychosis is a symptom or an episode. You can think of psychosis as a disconnection from reality, where it makes it very difficult for a person to determine what's real and what's not. It's as if the brain is playing tricks on them, making it hard to distinguish internal thoughts from the external world around them. The most common symptoms of psychosis are like delusions, which are fixed false beliefs that aren't based in reality, such as thinking that someone is out to get them when there's really nothing to worry about, or hallucinations, seeing, hearing, or feeling things that aren't really there. And a person may also exhibit disorganized behaviors like speaking in confusing sentences or acting in bizarre or unpredictable ways. I've also included at the bottom of the slide mental health conditions that are related to schizophrenia but are not exactly the same thing, but also involve or could involve psychosis as a symptom. These are also described as schizophrenia spectrum disorders. The first one here is delusional disorder, where someone may have strong false beliefs but without all the other severe symptoms that follow with schizophrenia. Next is brief psychotic disorder, which lasts for a short period of time and is often induced by extreme stress. Then there's schizophreniform disorder, which is similar to schizophrenia but lasts for a shorter period of time. And then there's schizoaffective disorder, which combines symptoms of schizophrenia with a mood disorder such as depression or bipolar disorder. And there are more disorders that exist on the schizophrenia spectrum, but I've only included these four as examples. So understanding the distinction between schizophrenia as a lifelong disorder and psychosis as an acute symptom is the first step to reducing the stigma surrounding these conditions. It allows us to see the person behind the diagnosis and approach their care with more empathy and understanding. So now that we've defined schizophrenia and psychosis, we may ask ourselves, what causes this mental illness? Well, there's no single cause, and it's more of a combination of biological and psychosocial factors, which can then become activated by environmental stressors. To understand this better, we need to consider the stress vulnerability model, and the diagram on the slide really shows that a person could have biological or genetic predisposition or vulnerability to developing a mental illness. For some people, this vulnerability is low, so they're able to withstand trauma or stressful events and not develop a psychotic disorder. And for others, their biological vulnerability is inherently higher. This could be due to genetics, like if you have a parent or sibling who has schizophrenia, or other contributors could be prenatal complications, like exposure to malnutrition or infections in the womb, or even complications during birth that affect brain development. Now, this biological vulnerability vulnerability doesn't automatically mean that a person will develop schizophrenia. This is where the psychosocial and environmental factors really come into play. These stressors can include things like significant trauma in childhood, major life changes, chronic social isolation, or substance use, particularly heavy cannabis use during teenage years while the brain is still developing. It's the combination of a biological predisposition with these external environmental factors that can ultimately activate the mental disorder. You can imagine a jar like the one in the diagram on this slide. You can see that biological and environmental vulnerabilities are slowly filling the jar, and when you add more than the jar can contain, it overflows. And that overflow is metaphorically the psychotic episode. It's like the brain's way of saying that it's reached its maximum capacity to process and cope, and once the brain becomes overwhelmed, that overwhelming pressure manifests as a break from reality, such as delusions, hallucinations, or disorganized thoughts. But when we're thinking about vulnerabilities and how much stress the jar can contain, we really have to think about heterogeneity. Heterogeneity basically means that the risk factors are incredibly diverse and affect people differently from person to person. Schizophrenia is not a one-size-fits-all disease. The combination of genes, brain chemistry, and life experiences that leads to schizophrenia for one person may be completely different for another person. There are more examples of diagrams on the website for early psychosis intervention, but one example is that a person may have a strong genetic predisposition to schizophrenia, and so a minor stressor could activate that mental disorder. On the other hand, another person may have a very mild genetic predisposition, but they experience such severe cumulative trauma or stress that their vulnerability is eventually pushed to the edge over time, thus triggering a psychotic episode. This heterogeneity is why schizophrenia is so hard to study and treat. It's also why two people with the same diagnosis can present with entirely different symptoms, respond differently to medications, and have vastly different recovery trajectories. So ultimately, understanding the causes behind schizophrenia and psychosis can give hope to families and individuals trying to change or improve themselves or improve their condition. While we can't change genetics, identifying environmental triggers and managing stress can significantly reduce the risk of triggering a psychotic episode. It empowers individuals and families to build resilience, create safe environments, and recognize early warning signs before it's too late. So now that we have a decent understanding of what schizophrenia and psychosis is, it may be useful to talk a little bit about the co-occurring mental and physical health conditions. Over 75% of people with schizophrenia have at least one chronic physical health condition that runs parallel with it. So first on the list here is depression. And when combined with the negative symptoms of schizophrenia, like social withdrawal and apathy, depression can really compound the person's isolation and suffering. Next, we can see panic attacks and panic disorders. And you could imagine someone who's already struggling to interpret reality and then being hit with sudden waves of physical symptoms like their heart racing or clammy hands or their face getting red. This can make the world even more unsafe and unpredictable for them. As well, many individuals with schizophrenia also live with PTSD. And this is particularly relevant because the experience of psychosis or some of the symptoms of schizophrenia can be deeply traumatic. And many individuals with schizophrenia have histories of significant trauma that predate their diagnosis. Obsessive compulsive disorder is another mental health condition that can co-occur with schizophrenia, such as when a person experiences intrusive thoughts and feels compelled to perform certain rituals to relieve that distress. For someone already dealing with disorganized thoughts, this can be like an additional burden. And finally, on the mental health side of things, there's substance use disorder. So many individuals with schizophrenia turn to drugs and alcohol in an attempt to soothe the distressing symptoms of their illness or the side effects of the medications that they take for it. Over half of people with schizophrenia will struggle with substance abuse at some point, and it's a factor that greatly complicates treatment and recovery. Now, turning to the physical health side of things, we can see that weight gain and obesity may co-occur because of the side effects of certain antipsychotic medications. And this rapid weight gain dramatically increases the risk for other physical or mental health conditions. Diabetes is significantly more common in people with schizophrenia, and while weight gain is a primary culprit, emerging research also also suggests that there may be a genetic link between the two conditions. And some of the evidence indicates that certain antipsychotics may directly alter how the body uses insulin. As well, for physical health, we may see a higher prevalence of viral diseases such as HIV and hepatitis in people with schizophrenia, and these are often linked to the high rates of substance use and the unsafe practices that follow with it. And this really shows how intertwined mental health, physical health, and social circumstances can be. Osteoporosis is another physical health concern, and it can be caused by a sedentary lifestyle and poor diet, which are common amongst people with schizophrenia. And finally, for the physical health side, we can see that sexual problems are a real source of distress, and actually a leading reason why some people may stop taking their medications. Issues like reduced libido, erectile dysfunction, and difficulty achieving orgasm are significant side effects of both antipsychotics and antidepressants. It's important to recognize that intimacy and sexual health are fundamental human needs, and these side effects can severely impact a person's quality of life and their relationships. And the heavy burden of physical illnesses is due to several reasons, such as sedentary lifestyles, poor diet, and high rates of smoking. Around 70% of people with serious mental illness are smokers, compared to 25% of the general population. So understanding these co-occurring mental and physical health conditions is really important because it reminds us that treating schizophrenia is effectively treating the whole person, and it demands integrated care that addresses both the mind and the body, and it calls for compassion for the immense daily challenges that these individuals face. So now I want to address the stigma, which is arguably one of the most damaging aspects of living with schizophrenia. While the symptoms of schizophrenia are already challenging, the way that society sees and reacts to these symptoms often creates a second layer of suffering that can be just as debilitating as the illness itself. To understand this better, we need to look at a moment in Canadian history that really brought the issue of stigma into sharp focus. So in 2008, a man named Vince Lee, who was living with untreated schizophrenia, committed a horrifying and unthinkable act on a Greyhound bus in Manitoba. It was a tragedy that shocked the nation and dominated headlines for weeks. And understandably, this event raised widespread awareness about schizophrenia. However, the way the media framed the story by focusing on the sensationalism and horror of the story generated mass panic and fear about schizophrenia and psychosis. The public perception became dangerously skewed, and suddenly millions of Canadians were left with the impression that anybody with schizophrenia is a potential killer, and that this disease was defined by violence and unpredictability. The reality, of course, is vastly different. People living with schizophrenia are far more likely to be the victims of violence, and they're more likely to harm themselves than to harm others. But the intense media spotlight on this one tragic case reinforced a deeply inaccurate and harmful stereotype that has been really difficult to undo. This is why the stigma of schizophrenia is often termed the second illness, because of the profound and devastating impact that it has on a person's life beyond the symptoms of the illness. We call it a second illness because it's like a disease in its own right. It can impact a person's self-esteem because directly or indirectly, people with schizophrenia are told that they're dangerous, unpredictable, or somehow less than human because of the medical condition that they never asked for. And over time, these negative messages can be internalized, and some individuals may begin to lose their sense of worthiness or their sense of identity. The stigma can also impact their quality of life, so they have a hard time finding housing, employment, or meaningful relationships. So the social isolation just adds to their suffering. The stigma also acts as a major barrier to help seeking, because since schizophrenia is so stigmatized, a person with schizophrenia may hide it from others, avoid reaching out to mental health professionals, and as a result, this delay in treatment can lead to a worsening of symptoms and a more difficult recovery journey in general. And finally, the most tragic outcome for individuals with schizophrenia suffering from the symptoms and the stigma is suicidality. So when someone is overwhelmed by their symptoms and feels completely rejected by society, their internal pain can become unbearable. The sense of hopelessness fueled by stigma is a significant contributor to the high rates of suicide in this population. So the question becomes, what can we do about it? The fight against stigma often takes place on several fronts, and this can be accomplished through anti-stigma campaigns, which often fall into two broad categories, such as the contact-based interventions and the protest-based interventions. interventions. Contact-based interventions are widely considered to be the most effective, and this approach involves facilitating direct, positive, and structured interactions between the general public and individuals who are living well with schizophrenia. When you meet someone face-to-face, hear their personal story, and see that they're just another human being navigating life's challenges, this can really shatter stereotypes. And it replaces fear with empathy, and it can humanize the condition for a lot of people. On the other hand, there's protest-based interventions, which involve challenging the inaccurate and negative portrayals of schizophrenia by the mainstream media. This includes writing letters to editors, holding public rallies, and publicly calling out stigmatizing language or imagery. So ultimately, reducing stigma requires a sustained and multi-pronged approach. It requires education, personal stories, and a collective commitment to seeing the person first. It requires us to remember that recovery is possible and that compassion is the path forward, and that it's possible to foster this attitude in the general public as well. So far in the video, we've already debunked a lot of the myths regarding schizophrenia and psychosis, but on this slide, I really wanted to address 3 of the most common myths, or misconceptions about schizophrenia. The first myth here, which we already went over in the last slide, but just to make it even more clear, most people with schizophrenia are violent or dangerous. But the fact is that even though people with schizophrenia can act unpredictably at times, most aren't violent, especially if they're getting treated. People with schizophrenia are more likely to be victims of violence. They're also more likely to harm themselves than others, and suicide rates among people with schizophrenia are high. The second myth here is that if you have schizophrenia, then you belong in a mental hospital. The fact is that the level of care you need depends on the severity of the symptoms. Many people with schizophrenia live independently, while some live with their family or in supportive housing in the community. And about this myth, I just want to make a comment that in Canada, there used to be mental asylums and institutions, but there was a movement to deinstitutionalize with the belief that social services in the community and the public health sector would be able to take care of these people with mental illnesses, except that hasn't been the case, and there are a lot of homeless people in, for example, the city of Toronto that suffer with these mental illnesses and with inadequate support. So although many people with schizophrenia live independently and live with their family or in supportive housing, there needs to be more support for people with schizophrenia and mental illness in general. And the last myth here says it can't be treated. The fact is that while there's no known cure for schizophrenia, treatment can help manage its symptoms and lessen its impact on one's life. Antipsychotic medications can help stabilize and lower the risk of future symptoms, and talk therapy and cognitive behavioral therapy are also helpful tools that can show individuals how to handle stress better and live well. So now that we've debunked the myth that schizophrenia can't be treated, we can now look at the psychotherapeutic treatment approaches to schizophrenia. And of course, there are pharmacological approaches to schizophrenia, such as taking medications and seeing a psychiatrist. And while those things are very, very important, I'm not going to be discussing those things as I focus more on the psychotherapeutic and social work interventions. First on the list here is cognitive behavioral therapy, or CBT, and its more specialized version that addresses psychosis in particular, which is CBT-P. And it's an evidence-based approach that doesn't try to talk a person out of their delusions or hallucinations, but instead works collaboratively with the individual to help them understand and manage their experiences. CBT helps a person develop coping strategies for the distressing voices or paranoid thoughts. It gently encourages them to test the validity of their beliefs in a safe and therapeutic environment. For example, if a person has delusions that their neighbor is plotting against them, then a therapist may help them explore those beliefs and help the person develop alternative, less distressing explanations. The goal is to reduce the distress and impairment caused by the symptoms, giving the person a greater sense of control over their mind. Next on the list is cognitive enhancement therapy. So while CBT focuses on thought content, CET focuses on thought processes. Schizophrenia often affects what we call cognitive functions, things like attention, memory, problem solving, and social cognition. CET is a structured program combined with group sessions. And it's like physical therapy for the brain, with repetitive, engaging exercises to sharpen those cognitive skills. Over time, it can really improve a person's ability to focus, remember information, and navigate social situations effectively. And this is crucial because these cognitive deficits are often the biggest barrier to living independently, maintaining relationships, and gaining employment. Next on the list here is psychodynamic therapy, and while it's used less as a standalone intervention, it still offers a profound benefit in response to acute psychosis or symptoms of schizophrenia. It provides a safe and consistent space for a person to explore the deeper emotional meanings behind their schizophrenic symptoms. It allows them to process the grief, trauma, and immense psychological impact from living with this chronic illness. By understanding the emotional narratives that shape their experience, individuals can develop a stronger, more coherent sense of self. Next on the list here, and perhaps the most exciting emerging intervention, is virtual reality therapy for auditory verbal hallucinations. For many people with schizophrenia, the most distressing symptom is hearing voices that are threatening, critical, or commanding. And while traditional therapy focuses on talking about the voices, virtual reality would allow a person to interact with the digital representation of those voices in a safe and controlled environment. So an example from the research on VR therapy in this field is where a person is placed in a scenario like a cafe or a train where they hear an avatar of the voice. And under the guidance of a therapist, they're assisted to respond to these voices. The individual can ask the avatar to speak more softly, to move away, or to stop being so cruel. So this is effectively exposure therapy and assertiveness training in a highly immersive setting. And the brain begins to learn that it has agency and that it's not helpless against these voices. In the initial studies and the articles I read for this video, the results are incredibly promising, showing significant reductions in the frequency and distress of auditory hallucinations. Now, the most important takeaway from this slide is that none of these therapies work in isolation. Schizophrenia is such a complex disorder that recovery requires a multifaceted and pluralistic approach to reintegration. This means combining these psychological therapies with taking medication and integrating physical health care to manage those co-occurring physical health conditions that we mentioned earlier. It means providing robust family support and psychoeducation so that even loved ones can be effective allies in a person's recovery journey. And it means addressing the social determinants of health, such as stable housing, meaningful employment and relationships, and a supportive community. Reintegration is about more than just managing symptoms. It's about rebuilding life, finding purpose, connecting with peers who understand the struggle, recognizing early warning signs to prevent relapse, and going on to contribute to their communities in meaningful ways. This multifaceted approach recognizes that every person's recovery is unique, so their treatment plan must be unique as well. It's a collaborative process between the individual, their psychiatrist, their therapist, their loved ones, and their community. As I mentioned before, there's no cure for schizophrenia, but there certainly is a path forward for each person with schizophrenia. And by moving from a model of managing a chronic condition to a model of facilitating a meaningful recovery, we can empower individuals with schizophrenia to improve their quality of life and go on to live meaningful lives. But that's just scratching the surface. If you'd like to learn more about schizophrenia and psychosis, I've left the sources for my video in the description below. And if you or someone you know is suffering from the symptoms of schizophrenia or psychosis and you're seeking mental health support or talk therapy, then don't hesitate to reach out to Recalibrate Therapeutic Services, where the experienced mental health professionals can help you with compassionate and non-judgmental care. Thank you for watching. I hope you learned something, and I'll catch you in the next video. Take care.